everyone. A very good evening to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us today. So, today we are here to present the 7th episode of Detect to Protect, a series of awareness session in fight against the breast cancer, which is organized by Voice of Healthcare and supported by Zydus Life Sciences. In today's session, we'll explore about the vital insights on breast cancer, from recognizing the signs and symptoms to importance of early detection, prognostic testing, and the latest treatment options. So let's come together to empower ourselves with the knowledge that protects women's health. Before starting the discussion, I would like to share some facts about the breast cancer prevalence in India. Breast cancer in India possesses a significant health challenge, accounting for about 14% of the global burden. The incidence is rising at 1.5% to 2% annually, with approximately 60% of cases diagnosed at advanced stages, which severely impact the treatment outcomes. The average age for diagnosis is around 45, younger than the global average age of 61 years, and survival rate varies widely from 70 to 80% in the urban areas in comparison to 40 to 50% in rural regions. Awareness of symptoms is really low, with only 20 to 30% of women informed about this disease, and less than 10% participate in the regular screenings. Cultural barriers, stigma further impede timely medical help, especially for the women with a family history of breast cancer, who are at the 2-3 timer higher risk than normal. These factors highlight the urgent need for improved awareness, education, and the healthcare access to address the rising burden of breast cancer in India. And in the light of these stats and facts, to begin with the discussion, first, I would like you all to please join me in welcoming our expert who is going to provide us with insightful information on understanding about the breast cancer awareness in India. I would like to welcome Dr. Asif Shaikh, consultant medical oncologist at Hemato Oncology Clinic, Vedanta, Ahmedabad. Good evening, Dr. Asif. Welcome to the discussion.
Good evening, and thank you for a nice introduction.
You're welcome, Dr. Asif. So let's delve into the discussion points. So, Dr. Asif, can you please provide us your view onto the risk factors and incidence of breast cancer in India? What are the primary risk factors that increase the impedance of breast cancer?
So you already spoke about the incidence of breast cancer, but what I can say is it is one of the most common cancer in females, or approximately 28% of female cancers are breast cancers. And risk factors, I would like to emphasize on very high risk factors and average risk. So high risk is family history. If you have family history of ovarian cancer or breast cancer in first degree relative, then the chances of breast cancer is high. Second thing is infertility and late childbirth. That is also very important, and infertility is also rising problem in India right now. So third thing is obesity and obesity and physical inactivity, and fourth thing is menopause and hormone replacement therapy. And fifth is not very common, but if somebody has Hodgkin lymphoma or some other cancer, and patient has undergone chest radiation in the childhood, then also breast cancer risk is high. And sixth one is pre-cancerous stage detection. So any in situ carcinoma or other atypical breast hyperplasia, if it is diagnosed, then actual invasive breast cancer chances are high in those population.
Thank you, Dr. Asif, for providing us with the risk factor and the incidence of breast cancer. I want to know, when we talk about the sign and symptoms of the breast cancer, so what are the early sign and symptoms, and how one people can differentiate in benign cancer or the potential cancer symptoms?
So I would rather differ slightly here, because before postmenopausal age was the main age group where breast cancer were diagnosed in past, but now young female also get diagnosed with breast cancer, and the incidence in young female, that is premenopausal women, is increasing day by day. So I would say that don't judge by yourself. Don't judge that it is benign or malignant by yourself. Just if you feel if there is any lump in the breast, just go to the doctor and check with mammography. If it is BIRAD category 3 or more, get biopsied, and the chances of cancer is high if it is BIRAD. BIRAD is a category which is defined in mammography test. So if it is BIRAD 1 and 2, there are very less chance of cancer. You have benign breast tumor. And if it is 3 or more, you should get biopsied to confirm or rule out cancer. If I'm supposed to answer your question, then yes, the signs of malignant breast mass is if it is fixed, if the redness is there, if nipple discharge is there, right? If it is fungating, or if there is a lump in axilla also, then there are high chance that it will be high BIRAD category in mammography. But don't judge by yourself.
Thank you, Dr. Asif, for enlightening us with the sign and symptoms of breast cancer. And I would also like to ask, what are the screening guidelines for the same? Like how one person should be should can screen about this breast cancer.
That is very important. Not many cancer has screening guidelines, but breast is one of the uh, one of some cancers that have very good screening guidelines, and that will be divided by in two categories. One is average risk population, and another is high risk population. Average risk means more than 40 years of age. With probably menopause. So postmenopausal women are average risk for breast cancer, and they should be screened by yearly mammography. So yearly breast mammography is very important if you are above 40 years of age. And we need to understand high risk category, because as I mentioned in risk factor, high risk factors will give clues a clue to a high risk population. And the things are hereditary breast ovarian syndrome, any family history of breast or ovary cancer, past history of chest radiation, or any pre-malignant stage detection, means any pre-cancerous diagnosis of breast tumor. Then these four people are at very high risk, and they should get screened if they are more than 30 years of age. And MRI, breast, and mammography, both tools should be applied, and both should be repeated yearly.
Thank you, Dr. Asif, for providing us with these insights. And in the following up of that, I would also like to know, is there any age recommendation or the frequency at which the screening should be performed?
That I already mentioned, that if it is average risk population, then more than 40 years of age and yearly mammography. If it is high risk population, then more than 30 years of age and yearly mammography as well as yearly MRI test.
And in following up of that, what are the various screening methods such as mammogram, ultrasound, MRI, and biopsy? So, how often they should be performed? And there are so many myths related to biopsy as well, that people are not very much open to do biopsy when it comes to breast
Screening
cancer.
screening method, I already described that two methods are very important: mammography and MRI breast. MRI breast is only for high risk population. It is not recommended for average risk population. Another important point you brought out is biopsy and fear related with biopsy. The most common myth is mera cancer फैल जाएगा क्या, but it is not like that, right? So biopsy is very very important. When some pathologist sees cancer cells in microscope, then only cancer diagnosis is confirmed. And any scan or any mammography can't confirm that you have cancer. Cancer diagnosis has to be done by biopsy. It should be tissue diagnosis.
Thank you, Dr. Asif, for providing with these insights. Can you please share the alarming sign and symptoms that women should be concerned about at the age? Since during the whole menstrual cycle, there are so many changes occur inside the breast. Maybe it related to tenderness, or maybe it's related to slight pain. So, what are the alarming signs there that women should be concerned of when it comes to breast cancer?
So as I mentioned, any lump, if you feel that there is a lump in the breast, then you should go to the doctor and get mammography done, right? Other signs and symptoms I mentioned, like nipple discharge, if it is bloody discharge, if it is pseudo the orange appearance, it is medical term saying that if it is the skin is fixed to the tumor, and if there is any enlargement in the axilla, and especially if it is painless lump. Painful lump generally occurs because of some other reasons, but these things are saying us that we should go for mammography and probably meet surgeon and or medical oncologist. But now don't judge by yourself. As I mentioned, don't judge by yourself. If there is a lump, just go to the medical oncologist, get mammography done.
Thank you, Dr. Asif, for providing us with these insights. And if we talk about the different stages of breast cancer, so can you please provide us with the insights onto that?
That is very important because early detection is the key of cure. uh, if you have been detected cancer in early stage, then chance of cure is increased. So stage 1 and stage 2 cancers are generally very local cancer. The differentiation is mainly based on the size of tumor. Generally stage 3 cancer also goes to the axilla, that is lymph nodes in axilla. So that is the next station where generally cancer goes from any primary site, first to the lymph nodes and then to the distant places. And fourth stage is the distant metastasis. So the cancer has gone out of the lymph node and breast and has spreaded to other parts of the body. And from first stage to third stage, cancer is curable. And in first two stages, cancer is curable in many cases. So the detection in early two stages are very important.
Thank you, Dr. Asif, for providing us with these insights. Also, I would like to know, is there any, I mean, a matter of difference when it comes to the rural area detection and the urban area detection? I mean, is there any difference have you seen or observed so far?
Definitely, definitely. So the more the awareness, the more the detection, right? We are seeing some patients with fungating mass in young female. Means I don't understand how can one just ignore fungating mass. The mass has erupted from the skin, and there was so much discharge, and patient was diagnosed in stage 4. So the awareness is very important, and that is why we are doing it, right? This live program is mainly because of that.
Thank you, Dr. Asif, for providing us with the insights in comparison to urban and rural areas. When we talk about the action step for the patient, so what step should a patient take if they notice any unusual changes in their breast, and what type of imaging or biopsies are typically used in diagnosis?
Right. So I already described in other answers. If you feel there is a lump, go to the medical oncologist or surgical oncologist, but any oncologist, and get mammography done. Sonomammography, actually both sonomammography. And in sonomammography, there will be BIRAD category. If you see the report, there will be written BIRAD category from 1 to 5. And if it is 1 and 2, then it is probably benign tumor. You don't need biopsy. If it is 3 or more than 3, then you will need biopsy.
Thank you, Dr. Asif, for providing us with these insights. When we talk about the prognostic testing in the breast cancer, so what are your views onto that?
So now we have jumped to probably hormone positive, HER2 negative breast cancer. Before that, we should at least elaborate that is the question probably from my point of view should be, is every breast cancer same? So the answer is no. Breast cancer actually is dependent on the type of breast cancer, which will be decided by hormone report and HER2 report. So every breast cancer is different, but the breast cancer is mainly categorized into four subgroups, and it is dependent on mainly two reports, hormone and HER2. Why it is so? Because if hormone receptor is positive, then hormonal therapy will work, and hormone positive breast cancers tend to do better. The prognosis is better. It generally occurs in postmenopausal women, means after menopause. In HER2 positive breast cancer, there will be targeted therapy, and it will be a wonderful response in many patients with trastuzumab and now pertuzumab also. Right. So which type of therapy will be applied, and what type of prognosis will be dependent on type of breast cancer. The aggressive one is TNBC, triple negative breast cancer, and the incidence is mainly high in young females. Right. Now come to your question, because your question needed this description. Prognostic testing mainly applies in hormone positive, HER2 negative breast cancer, because in early stage hormone positive, HER2 negative breast cancer, previously we used to give chemotherapy on the basis of size of tumor. It is, if it is more than 1 centimeter, we used to give, but we gave 4 cycle instead of 8 cycle. But in some patient we over treated. So now the understanding of genetics will help us choose the patient who will need chemotherapy and who will not need chemotherapy in only hormone positive HER2 negative breast cancer. So there are mainly two genetic tests worldwide approved, that is Oncotype DX and MammaPrint. And also Zydus has come up with Canasis, which is wonderful test, and it is also a cheaper option in comparison to Oncotype DX and equally efficient. So one of these three tests should be done and should be seen that if it is early breast cancer, then only, not stage 3 4, only first and second stage. And we should see that is it high risk or low risk. If it is low risk, we can safely omit the chemotherapy, and we can give chemotherapy, we should give chemotherapy in high risk population in this prognostic testing reports.
Thank you, Dr. Asif, for providing us with the insights on understanding about the prognostic testing when it comes to breast cancer. Moving ahead with the discussion, to know more about the genetic testing insights when specifically we talk about the breast cancer. So, can you please enlighten us with that?
Yeah, so probably I covered that answer. Oncotype DX and MammaPrint are basically genetic reports, and now we have Zydus Scan Assist also, which is available in India, which is equally efficient report. So yes.
And if we talk about the gene mutation like BRCA1, BRCA2, so I mean, how it
So
influence
so
and
if you're asking me uh, for advanced breast cancer, then yes, and also now adjuvant therapy. So you brought up the very big topic now, BRCA gene, BRCA gene, and
yeah.
BRCA gene has very prognostic as well as predictive importance. Means it will also tell us whether it is hereditary breast cancer or not. First thing is that. Second thing is it will predict, so it will tell us that some targeted therapy will work or not. So there is now target therapy available for PRCA gene, that is called all PARP inhibitors, and olaparib is the prime example of that, and which is now easily available in India. So we used to give in advanced breast cancer, which is BRCA positive, but now we also can give in adjuvant setting after surgery. If it is high risk for a relapse, then in after surgery we can give it in germline BRCA positive and in TNBC patients.
Thank you, Dr. Asif, for providing us with these insights. And I also want to know, I mean, how women should be concerned about it if she has some genetic history with the family or maybe extended family, and how it works. Should she consider about the extended family thing as well, or just the paternal and maternal side?
So that is a very great question, and that is a big worry in many patients and relatives' mind. And thank you for bringing up that. I'll rephrase the question. When we should think that it is familial cancer, when we should think that it will run in the family, and when we should do the genetic report to diagnose any familial cancer. So not all cancers are genetic disorders, but not all cancers are hereditary or familial. Only 8 to 10 percentage of breast cancer will be familial or hereditary. And when we should suspect it, so it again depends. Now it not only for understanding that it is hereditary or not. Now we have medicines also to target BRCA gene. So any triple negative breast cancer, we should do that report, BRCA report, to understand whether it is hereditary or not, and also because we can provide treatment for that BRCA gene. But if you are uh, young female, premenopausal, and you have breast cancer, you should do genetic report to understand it is hereditary or not. First, second, if you have family history of first degree relative, that is very important to understand what you wanted to ask. That mother, father, brother, sister, and son and daughters. These only are first degree relative. No husband or no wife, or no husband's family or no husband wife's family, right? So first degree relative, if there is any history of breast cancer, ovarian cancer, then also you should get tested for BRCA mutation in blood, that is germline. And third thing is, uh, you know uh, if you have second primary breast cancer. I have some patients who are not matching the age group upfront, but they develop second primary breast cancer after 2 years of first breast cancer diagnosis. In other breast, now there is a cancer which is new entity now. So if bilateral breast cancer, history of bilateral breast cancer, then also you should get diagnosed you should do genetic testing for hereditary breast cancer.
Thank you, Dr. Asif, for providing us with these insights on this really important topic when it comes to genetic testing and in terms of breast cancer. Moving ahead with the discussion, if we talk about the treatment part of breast cancer, so can you please enlighten us with that?
So any cancer has three treatment options: surgery, radiation, and medicine. And all three branches are different. All three oncologists are also different. Surgical oncologists will do surgery, radiation oncologists will do radiation therapy, and medical oncologists will use medicines to suppress or cure cancer. So coming to the breast now, mainly depends on the stage and type of breast cancer. So if there is operable breast cancer, means first to third stage, then also if there is aggressive type like HER2 positive or triple negative breast cancer, you will need first chemotherapy plus or minus targeted or immunotherapy, means some kind of medicines first, that is called neoadjuvant therapy, followed by surgery, and followed by after radiation and other medicines. But if you have very localized less than 2 centimeter mass, then the type actually doesn't matter. Less than 2 centimeter mass, you should get operated first and then decide what adjuvant therapy should be used. So now nowadays, in most of the patients, if it is more than 2 centimeter tumor, and if there is any axillary lymph node positive in the report, then in majority of patients now there is tri-modality treatment. All surgery, medicine, and radiation will come into the picture. But it is not same in stage 4 breast cancer. Stage 4 breast cancer is mainly treated by medicines, and the reason is surgery and radiation are local therapy. So when it is localized, then you can use local therapy to cure it. But when it is not localized, like stage 4, when it has spread out from breast and lymph nodes to other parts of the body, then you have to give something in blood, because blood will reach out to the every tissue of the body. So medicine will work in that situation. And the intention will be mainly in most of the patients with stage 4 breast cancer is palliative, so to improve the quality of life and to increase the longevity of life. But the wonderful thing is now we have so good medicines that some patients, not some, many patients will have much longer lifespan with good medicines and good response. So in stage 4, only medicine.
Thank you, Dr. Asif, for providing us with the treatment options available in the breast cancer. And if we talk about the latest advancement in breast cancer treatments like targeted therapies and immunotherapy, so what are your views onto that?
So latest advances in breast cancer will need another half an hour session, but I would focus only on medicine, right? And you partly push me toward that targeted. Just speak about targeted therapy and immunotherapy, and I appreciate it. So in targeted therapy, immunotherapy, also there is lot of development going on in all types of breast cancer. I just quickly go through the type of breast cancer and advances. So if
Yeah.
I speak about triple negative breast cancer, immunotherapy has much more role now. It is used upfront in neoadjuvant setting also before surgery in operable breast cancer. That is wonderful thing, and we are having patients now which are cured in bigger number than in past. Second thing is olaparib, which we discussed, a PARP inhibitor, which is used for BRCA gene mutation. It is also used very commonly in TNBC if it is germline BRCA positive patient. Third thing is sacituzumab govitecan. It is newer antibody drug conjugate, that is very new medicine which is used in advanced breast cancer. So these are the updates for triple negative. Now come to the HER2 positive breast cancer, and the list is never ending, and it will never end, because it started with trastuzumab, then comes pastuzumab. So all antibodies, then comes antibody drug conjugate, that is newer medicine. It is very interesting. People also should know antibody, how does it work. It just goes to the target and just fix to the target and activate the immunity, and like that it will get killed by both ways. But antibody drug conjugate will have chemotherapy attached to the antibody, so it will fix to the target and deliver the chemotherapy at the exact site where it is needed. So it is smarter way of delivery of chemotherapy. Plus it will also provide benefit of antibody formulation as well. So antibody drug conjugates are coming in a big way, and in breast cancer HER2 positive, initially TDM1 came, which Zydus also has, and now TDXD, that is the newest ADC in HER2 positive breast cancer, which is breaking the bar now, right now, and it is very active in very advanced stage, HER2 positive breast cancer also. And hormone positive also, there are new targets coming up like PI3 kinase mutation. So other genetic mutations will open the gateway of using other medicines in hormone positive breast cancer. So the research is the at the maximum speed and the maximum bar in breast cancer. So probably in future, I hope that there is no need of surgery, only medicine and radiation, right?
Thank you, Dr. Asif, for providing us with these insights on advancing. And I think it's really enlightening to know about these latest developments in terms of breast cancer treatment. Moving ahead with the discussion, I would like to know what are the preventive lifestyle changes one can adopt to reduce their breast cancer risk.
Right. That is the most important, portion of this live session. And even if you are, burst in between, you should wake up and listen to this, because prevention is better than cure. And as I mentioned about the risk factor, first thing obesity and this physical inactivity, and you should focus on that, because obesity is a disease now. It will attract so many diseases, that you will get at least one of those. So proper body weight according to height, proper muscle mass according to your height, and muscle fat ratio, that is very important. People try to lose weight and they lose protein as well, muscle as well,
Hmm.
during that process. So it is very important to understand that not only losing weight and maintaining weight is important, but the protein fat ratio of your body is equally important to prevent cancer as well as other many diseases. Second thing is physical inactivity, which is very alarming in our generation. Probably my son has a white, but I'm still young. So in our generation, the sedentary lifestyle is a big problem. At least 30 minutes exercise, or 30 minutes daily walking or running or swimming, whatever you like, cycling, but just do it for your body. Physical activity is very important. If you have sedentary job, then physical activity for 30 minutes is very important. Infertility is also very rising, so treatment of infertility should be quick, and you should get married, and late childbirth should be avoided. I can't lecture on other things, but at least more than 35 years of age, and you are pregnant first time, then the risk of breast cancer is high. You should avoid that scenario. And third thing is postmenopausal and hormone replacement therapy. So hormone replacement therapy should be used with understanding of risk benefit ratio, risk and benefits, and should be used only when necessary, right? And other things are so other things are not much preventable. That, like, if you have gone through radiation on chest, then you have gone through the radiation. Now you can't do anything, but you can detect it early by doing a screening program regularly, like I mentioned. And if you have pre-cancerous stage diagnosis, then also screening program is very helpful.
Thank you, Dr. Asif, for providing us with the advices and the recommendations. And I think this is going to be really valuable for the people who are listening to this. In conclusion, our objective for today's discussion was to explore and emphasize the importance of breast cancer by integrating insight on recognizing the signs and symptoms, screening part, and the treatment developments. And I'm confident that our experts have addressed this crucial topic very comprehensively and effectively, that the layman can also understand it. I would like to extend my gratitude to Dr. Asif for your insightful contribution and for sharing your expertise with us. Your participation has been really valuable, and we deeply appreciate the time and knowledge you have shared. So, thank you so much for joining and contributing to this important conversation. Thank you so
Thank
much.
you. Actually, it was my pleasure to be with you all, and to give something what I know. And if it is benefiting some people, then I'll be grateful. Thank you.
Thank you so much, Dr. Asif.
Thank you. Bye.